throughout the day. I have a demographic sheet where I see their name, age, address, healthcare, and very few on there are ever uninsured. So I would just like to mention that, and as well as the interpreter issue that we've been talking about in this healthcare bill. In our hospital, everybody has access to an interpreter. Within a few minutes, we can have a phone that we can plug right in and have a conversation with an interpreter and the patient, answer any questions. There is no lack of interpreters. That's not a problem that I can ever say. And definitely issues of transparency and accountability in tort reform. Absolutely.
Go to this quality of care issue because I think that some of the statistics that Joel quotes, I think are correct, and I don't think he's being disingenuous, but the question is, again, on what metric, if we have great technical cures, some of our outcomes may indeed be based on trying to control for the very factors he recognized earlier. In other words, perhaps we're not behaviorally as healthy, so we have poorer outcomes with, with kind of ordinary circuit. In other words, there are a lot of things that can contribute to this, but I think the tenor of the comments, somewhat in support of our healthcare ability here, also, they represent a basic satisfaction with the system. Would we wish that it didn't inflate faster than the cost of other things? Yes, but are we willing to go without the high-tech fixes? We've kind of decided, I think, that we, as difficult as the system is, as expensive as it is, that we have come to prefer it. And that's not to take away, if you can go to Canada and let's forget the war of the anecdotes and, Randy's been waiting for a hit for a while. I mean, I think you can also go to Canada and find a great many people who are happy. That's the context in which they live. They're happy with that system. And that probably could be true in Britain and France. But I think that in general, we're happy with the system for delivery. Find some possibility with ourselves, and the more it could be consumer-driven, I think the better. I think we would be happier. And unfortunately, these reforms seem to be moving away from allowing us that input into the system. And this is personally, and I don't want to speak it, I'm much less worried about having higher deductibles and copay if I can have better interaction with the system and a more straight up interaction with doctors. I'd much rather deal with paying some of those bills as long as I'm in control and I know that the catastrophic stuff is covered.
Right.
Yes, sir. My name is Steve Silva. I'm from North Smithfield. Statistics can be misleading, and I read something about that infant mortality statistic. I'm not sure if it's true. And you guys are experts and provide a lot of good information. Maybe that's straight. What I had read was that you're not an infant. You're not labeled an infant for 30 days that you're a newborn, and that because of that fact, the fact that in America, because of the technology and medical stuff we do have, our most severe cases last that 30 days. Elsewhere in the world, you're dead. You're dead as a newborn.
Anybody else have questions that hasn't had a chance? Like if somebody hasn't had a chance.
Yeah, Willie Wilson again. I'd like to make a statement on health care. Our granddaughters, twins, born at 25 weeks. They are alive today at 3 years old. Where else would that happen but in this country? I worked with statistics for 30 years in the business world. I could twist the statistics to my so I don't believe it. My sister-in-law over in Germany, my wife needed a hip replacement. She was diagnosed. She had her hip replacement within 2 days. My sister-in-law worked on her shoulder. She had to teach for 7 years until she was unable to raise her arm and she finally got an operation. You want to live over there with their statistics? Go.
So my first comment would be that I think that the video that you're going to send to Patrick should also go to the Congress and to the Senate. And I also think that our president that's over there at the moment.
Do they have a DVD player?
Wait
I'm sure he has all the airplanes he has over there at the moment. But the one comment I would like to make is, and this is maybe just a short example, when you were talking about care in other countries. My sister-in-law and brother had a summer home up in Canada, and my sister-in-law had a stroke. And so she went to a local medical there in Canada. Of course, they had a more American, you know. And they didn't have the equipment there for her to take the medical that she needed, the blood pressure cuff, and there was also something else. And her doctor suggested that they come back to the States to have a test to take that she needed to have in order to that she lived. So, and I know of other examples of things that are going on outside of the United States. So, although there may be some things wrong with our system, I still think we have a better system, as the gentleman said, faster and quicker. Okay? There's things wrong with it, no question about that. I think that's all I'm going to say.
Hi, my name is Dave Kaplan from Princeton. I appreciate it.
Thanks, Dave.
I appreciate you going against Kennedy. I'm kind of upset as a citizen and taxpayer and a law-abiding person that this guy can't show up. It really bothers me that he can't run out. I'm tired of the riding his name for Kennedy. What does it mean? You're born a politician, you're born to make controls on me and vote a cap and trade when you can't even conduct yourself? It's bull crap. You should be here and man up. I'm tired of it. You know, anybody here, I see a gentleman with 4 kids. God bless you, wherever you are. And God bless your children. I see this country going into 2 different pots. You got a bunch of people going to Brown telling us how to live, and you got a bunch of people out here trying to work and make a living. I see a lot of people here that already paid their dues, and you got a president basically cutting them at the knees. Where's the America I know? This ain't the America I know. I believe in the First Amendment and the Second. And my question to you is, it's 2 parts. Number 1, what's your stance on the First and Second Amendment? And my second part of the question is, we heard on a radio show that if the government passes a health care plan, that they can tell us, that the government can tell us to change the plan or we'll go to jail. That was on a show, and it was saying like they pass it. And you know what? After what I've seen, I'm 50 years old. What I've been seeing the last couple of months has been surprising.
All right, well, let me take your question in the order we got. The first part of your question is, where do I stand on the First and Second Amendment? All right. On the First Amendment, we're all here tonight because of my belief in the First Amendment. We all have a right to be heard. We all have a right to assemble and have free speech, and that's why we're here, and that's why I believe in the First Amendment. As far as the Second Amendment, you can look them up. My NRA rating's been an A ever since I've been in office.